So in some ways, that's all that needs to be said. But I want to give you a little bit of background. This certainly didn't happen without a great deal of effort by many people, as you can see. I want to thank, first of all, the Susan and Michael and Susan Dell Center for Healthy Living for having this program and for giving us the opportunity to display what's going on in Brownsville, and to me personally for being able to nominate my wonderful colleagues who have been so instrumental in the leadership for making all of this happen. Obviously, this didn't happen by accident. We started this journey 14 plus years ago. Two of us came to Brownsville, went to Brownsville. We had two people, two computers, and two desks at UTB. We didn't have a building at that time, and we were starting a new campus for the School of Public Health there. But there was a focus, and the story was focus, empowerment, and commitment. The focus was, let's do good science to understand not only what the problem, the nature of the problem, but also how big it is. In other words, measure the burden of disease. How much obesity do we have? How much diabetes? How much heart disease? So that was and then to make that into action, to turn that into action in the community. It's one thing to do something and publish a paper. It's another thing to provide that information to the community and try to help motivate the community, empower the community, if you will, to take action on it. So that was the second thing, empowerment, and I think you saw that here. 3 or 4 people coming to and starting a Brownsville campus, or even 10 people, were not going to change the health of Brownsville. By the way, Brownsville is the poorest city in the country, and it's got one of the lowest rates of education. It's a young population, but with tremendous, as you can see, tremendous health disparities. So it was not going to be a few academics at the School of Public Health. It was going to be the people themselves. So empowerment was important. And finally, commitment. We had to say, we're going to be with you. We live in the community, we're part of it, and we're committed to working with you as you move forward in this journey to a better health. So Brownsville is 180,000 people. It's on the border. We can walk out of our house, out of our campus, and be in Mexico in about 7 minutes walking. Maybe we don't walk as fast as we once should have, but 70% of people speak Spanish. It's as I said, a very colorful and wonderful community, but with lots and lots of health disparities. So tonight it's my privilege to honor 3 of our leaders who have helped with all of the aspects that I talked about, the science, the empowerment, and the commitment. And I want to just say a few words about what they've done together, and then just highlight a few things that each of them has achieved in this journey of the community to a much better, healthy life. Together, these 3 people, Dr. Susan Fisher-Hawk, Dr. Belinda Reiniger, and Dr. Rose Gowan, who's not able to be here tonight because Dr. Gowan is also a city commissioner, and tonight was a huge budget meeting for the city commission, and she had to be there. So we can understand, and when you see, and that was, by the way, Dr. Gowan who was narrating that video. So she's still very active. So together they have obtained grants. They have and those grants have supported the beginning of the work, so they were very important, the NIH grants. They have defined the extent of the problem of obesity and related conditions and published that information. Why is that important? Because it gives credibility to the information, and that information then becomes available for good decisions. They have developed and executed together multiple interventions and many partners with many partners throughout Brownsville and beyond. We now extend out into 2 counties across the entire region. They have created and implemented 1115 waiver programs. For those of you who are familiar with the 1115 waiver, we have 8 programs on our campus, and that is bringing almost $40 million to not only our campus, but more importantly to our community. And it is funding many important programs run by these nominees. So incredibly important work. And the science behind what we did was key in being able to obtain those funds. And this work, as you may know, has resulted in numerous awards, including the Robert Wood Johnson Culture of Health Award in 2014 and the All-American City Award for Health in 2014. Imagine the poorest city in the country gaining those kinds of awards. It's pretty amazing. So let me say a word about Dr. Fischer-Haack. She's been the core principal investigator on the first NIH grant that we had. And she helped to create the Hispanic Health Research Center and the Cameron County cohort, which is a major scientific investment which is measuring the burden of disease in our population and providing information to our community about that. Only today she reviewed a paper that's about to go out about the health of men in our community. And it turns out that we have over 50% obesity in our men below the age of 35, 17% of whom already have diabetes, and probably more than that, I'm sure more than that, have prediabetes. So, General, we have a long way to go, but we're all in there in the trenches. So Dr. Fischer-Haack has published multiple key papers that help define this. She also is the one that contacted Peter Cribb initially to help set up the CATCH program in Brownsville. She served on the farmers market, and she's published a number of the papers that were critical for the work that we're doing in the 1115 waiver. Dr. Reiniger is one of the most amazing leaders in the community that I have ever had the privilege to work with. She also was a PI on a core PI on the initial NIH grant that helped set all this up. She created the Community Advisory Board under this initial grant, and the Community Advisory Board now has been together we're going on 12th year, I think now. An amazing organization that really helps us to translate what we learn into health of the community. She's the mother of two Salud Cuenta. She's developed a community-based participatory research program, providing many grants to many organizations in the community to help them learn how to, literally to empower them. She set up the Brownsville Biggest Loser program, a major program that's on now for 5 or 6 years. It goes on for several months every year, and it's an amazing number of people, well over 1,000 people who participate in this program now. Belinda conceived of the farmers market and was instrumental in getting it going, along with Dr. Gowan and Dr. Fischer-Haack. And she works with the the City of Brownsville Health Department director in implementing many of the policy changes that have occurred in Brownsville, from smoking policy to safe street policies. And she also, in her spare time, runs 5 of the 8 waiver programs. And just to illustrate, we have grown now we have 5 faculty. We've grown from a handful of staff. I think we're up to about 115 staff. And so they're incredibly busy. Let me say a word about Dr. Gowan. She is absolutely amazing. She's an OBGYN physician, grew up in Brownsville. She came to us and said, this one-at-a-time thing as a doc is not necessarily what I think is the best thing to do. Is there something I can do to help? And so she began as the medical director of our clinical research unit, which we also started with our NIH grant and with some other NIH funds. But she started to get more active in helping to create the farmers market and in working in the community. And a group of business people came to her and said, we really like this health stuff you're doing. Would you be willing to run for one of the city commissioner positions? They said, we'll fund you and help you if you're willing to do that. She was elected. She's now been reelected, and that's why she's not here tonight, because she has to see to the budget. Otherwise, she doesn't know what's going to happen if she's not there to see for the budget. So, and she was clearly very instrumental working with the city of Brownsville in putting in the Robert Wood Johnson Award information and for securing that award. So these are three amazing people, leaders who have provided science, empowerment, and all of them have been committed now for, we're going on 15 years in working in the community. So I want to thank them. I want to thank all the folks here at the center. I particularly want to thank Donna Nichols and Heather Atterbury, because when I started filling out this form, I said, am I writing an NIH grant, or am I just filling out a form for this award? So I can tell you that they really want the facts. They don't want just to say how nice people are. They want to know, what did they actually do and what have they achieved? So I applaud you for that. And I really, I can't say enough about my colleagues who have done such wonderful work and continue to do such wonderful work in Brownsville. So thank you very much. Dr. Fischerhock?
And Dr. Reininger?